I believe that health care is a right that should be provided by our federal government.
Why do you believe that?
My God, you are a free health care denier. Everyone knows that health care is a basic human right.
Please tell me about the details of your belief.
What details are you asking about? What do you mean by this question?
You have said that free healthcare is a right. How does this free healthcare get delivered to the people who want it? Who will deliver this free service? Who will compensate the doctors and nurses who will deliver this healthcare for free?
You are a free health care denier. You do not care about people.
Okay. Back to my question. Who will pay for this free healthcare?
The answer is very obvious. The greedy insurance companies will pay for the free health care.
The greedy insurance companies will pay? What is insurance? How does it work?
What do you mean by the question? What is insurance?
I mean, how does insurance work? Insurance is a business transaction between agreeable parties to share risk. Do you understand the concept of shared risk?
Shared risk. Insurance. What do you mean when you say shared risk? I do not understand what you are talking about when you say shared risk.
Perhaps to begin to understand what insurance is, we should take a look at a world without insurance. Let us say, for the sake of this discussion, that there are no greedy insurance companies. There is no insurance. Let us say that you are climbing a ladder on the side of your house and you fall. You crash to the ground and break your arm. At this point you call an ambulance and they take you to the hospital to have your arm repaired. There are numerous parties involved in the repair of your arm. There is the ambulance driver, the nurse at the emergency room, the hospital which provides the emergency room, there is the orthopedic surgeon who repairs your fracture, there is the anesthesiologist who puts you to sleep, while the surgeon repairs your fracture. All of these people want to be paid for their services. Remember now that there are no greedy insurance companies to pay them. Who will pay them in a world without insurance? You must pay them.
No. You have it all wrong. I believe that health care is a basic human right. I believe that everyone should receive their health care without having to pay anyone.
Okay, then you must also believe that doctors, nurses, and hospitals should render their services for free. How will the hospital pay its utility bills, staff, and other expenses if it does not charge a fee for its services? How will the nurse pay for her groceries, rent, utilities if she is doing her work for free? How will the doctor pay for his rent, groceries, gas, and utilities if he offers his services for free? The truth is that they can't. The people who are providing the services must be paid in order to survive. The actual cost to have your arm repaired will be $10,000.
I still do not understand the concept of shared risk.
Okay, I will explain it to you. Insurance is the same thing as shared risk.
What does that mean?
The insurance company pools people together who are willing to pay a fee to share their risk. The insurance companies calculate the fees that must be paid for the insurance based on the amount of fees which will likely be paid out. I will give you a very simple example. Let's say that you and I agree to share our risk of falling off of a ladder and having to pay the hospital and doctors to repair a fracture. We know that the expense to repair a fractured arm will be $10,000. We also know that it is highly unlikely that both of us will fall off of a ladder and break our arms. Both you and I put $5,000 into an account. Should one of us fall and fracture our arm, the funds are available in the account to pay for the repair. You and I have shared the risk.
I still do not understand the concept of shared risk. Would you please give me another example?
Sure. Let us take 10 people who all drive cars back and forth to work. How much will it cost to repair one of those cars if it accidentally crashes into a tree? Let us say, for the sake of the discussion, that the repair will cost $10,000. Next, we need to determine how likely it is that someone will crash their car into a tree. After studying 10 years' worth of auto repair bills and accident reports, we conclude that 1 out of 10 cars will crash into a tree each year. This is what insurance companies are experts at. They study the history of actual risks and expenses, so that they will know very precisely what the likely risks and expenses will be for any given group of customers.
I think I am getting lost in this discussion.
Okay, take 10 drivers who want to share their risk of having to spend $10,000 on a car crash. Each of the 10 drivers will put $1,000 into a joint account. Now there is $10,000 in an account. One of the 10 drivers will crash into a tree. The $10,000 will be used to repair that driver's car.
All right. I think I understand what you mean by shared risk. I still believe that health care is a basic human right.
You are entitled to believe whatever you like. I would only ask that you include the fact that the word free is a lie. There is no such thing as free health care for all. Ultimately, someone must pay.
I believe that no child should ever go hungry. I believe in free food for everyone.
I don't want to go there. Goodbye.